Good evening, everyone. I'll be presenting on clinical profiles of patients presenting with proptosis in ophthalmology department at a tertiary healthcare center. So proptosis is defined as abnormal protrusion of the eyeball if the distance between the lateral orbital rim to the corneal apex is more than 21 mm, or if there is a difference of 2 mm between the two eyes, it is known as proptosis. The causes of proptosis can be numerous, like neoplastic, inflammatory, vascular, traumatic, or structural. My study, this was a hospital-based prospective observational study conducted for a duration of 18 months, and the sample size was 22. The inclusion criteria was all patients presenting with proptosis who cooperated for the ophthalmological examination, and exclusion criteria was patient with history of trauma, critically ill patients who couldn't follow till the final diagnosis was made, or who did not give consent for the study. They were subject to detailed evaluation, including proptosis evaluation, and relevant investigations like blood investigations and radiological investigations were done whenever required, and the patients were managed according to the standard protocol. A total of 25 patients were studied. The age distribution, it was found to be maximum 20 to 29 years of age and 40 to 49 years of age. More common in males, and it was more of unilateral proptosis. In terms of etiology, the most common cause was inflammatory, constituting about 56%, then neoplastic, and then vascular, and infective. The diagnosis, thyroid eye disease, was found in 13 patients, and keratoconus fistula was found in 2 patients, and the rest 8 were neoplastic etiologies. The exophthalmometry values, the axial proptosis had more 23.77 plus minus 2.11 mm, and the abaxial proptosis had more exophthalmometry value with a p-value of 0.016, and this shows the distribution of exophthalmometry values, which was maximum in 20 to 24 mm range. This picture shows bilateral proptosis, the above one in thyroid eye disease, and the lower one unilateral proptosis in thyroid eye disease. Then there is a patient who presented with left eye proptosis, and he was diagnosed with as a case of lymphoma. And one patient who presented with left eye proptosis, MRI showing mass in the left sinonasal cavity extending to the left orbital cavity, and the histopathology was consistent with angiofibroma. This was the case who presented with right eye proptosis with episcleral vessels, right superior ophthalmic vein was dilated, consistent with keratoconus fistula, and one case of orbital cellulitis was found in my study. So there is a gross disparity as to incidence of various lesions reported in different studies. So in these studies, we described the clinical presentation spectrum of etiology among patients with proptosis. This is just a table comparing my study with the various other studies which were retrospective as well as prospective. And conclusion, the eye can see only what our mind knows. So this study affirms that detailed history and clinical evaluation gives valuable hints to the etiology of proptosis. Thank you. These are my references.